For more on the Biden team's response to the pandemic, let's bring in Dean of the Brown University School of Public Health and ABC News medical contributor, Dr. Ashish Jha. Dr. Jha, always great to have you with us. I want to pick up on what Karen was talking about there. Today, officials said distributing 100 million vaccine doses in 100 days is the floor, not the ceiling. And this comes after President Biden said yesterday he was ordering 200 million more doses. What is really feasible here, and what should be the goal for the vaccine rollout over the next 100 days?
Yeah, great. So thanks for having me on. The 100 million for over 100 days was something President Biden said back in early December. I do think we need to do better than that, given where the situation is. What would I like to see? As much as possible, right? I think we may be able to, if things go very well, we may be able to get to 2 million doses a day, or even 200 million over the next 100 days. That's going to be hard. We're going to need to do really well on production. We're going to have to do great on administration. But I think we can do it. And so that, to me, is sort of the stretch goal. But the goal really is vaccinate as many people as quickly as possible, because that's how we're going to save lives.
And Dr. Jha, we're all watching what's happening over in the United Kingdom with that variant that they're struggling with there, and it is alarming. The UK reporting today they've got the highest COVID death rate in the world. So how much of that do you believe is due to this highly transmissible variant? Should we expect something similar if that should come ashore? It already has in the United States.
Yeah, unfortunately, that variant is here, and I think the highest death tolls in the world in the UK are almost surely because of that variant. So the question is, how do we avoid that fate? How do we avoid a massive spike in cases? Two things. We've got to get people to follow the basic public health stuff, distancing, upgrading the quality of their masks. That's going to be really important. But the second is a race for get people vaccinated. And I've been saying for the last couple of weeks, right now there is a very urgent race, and that is between us and vaccinating people versus the variant. Obviously, I want us to win, and we're going to win if we can get a lot of vaccines into people's arms.
Dr. Jha, picking up on that point, because you mentioned there's the race to vaccinate, but it's the race against the variant at the same time. And we're told that the companies that make these vaccines are doing more research on how well the vaccines will protect against the new variants. What do we know about the efficacy so far? We know there's concern with the variant in South Africa especially. And what are the options for improving the vaccines in the future?
Yeah, great question. So right now, I feel very confident based on all the data that the UK variant, the one that's here, the one that's spreading, is something that is going to be very susceptible to the vaccine. So I think the vaccines will continue to protect people against that. There is a bit more concern about the South Africa variant. The good news is we haven't yet seen it here, hasn't become dominant here. Boy, obviously, I hope it doesn't. And companies are working on new formulations against the South Africa variant as a backup, but my hope is we won't need it because we'll get so many people vaccinated here that we'll really be able to stamp this pandemic down. Dr.
Ashish Jha, thank you for your time. We always appreciate it.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.